Hello there, welcome. Today we are going to be talking about problems with and caring for your little girl's genital area. My name is Sarah Hunstead and I almost forgot my name then. My name is Sarah Hunstead. I am a paediatric nurse. I'm also founder of CPR Kids, and I've also have two girls of my own. And I am very happy to be joined again by Dr. Deb Levy, who I've had the absolute pleasure of working with over the years in a paediatric emergency department. But Deb, why don't you go ahead and introduce yourself and what you do, and then we will get into this Facebook Live.
Great. Thanks, Sarah. And hi, everyone. My name is Dr. Deb Levy, and I am a holistic pediatrician as well as also a mum to two girls. Mine are a little bit younger than Sarah's. They're 4 and 6. I have a clinical practice in Bondi Junction in Sydney's eastern suburbs, although I'm currently on leave living in wintry Canada until the middle of the year. And I also have another passion on the side other than my clinical work, and that's educating parents, really empowering you, mum and dad and carers with the knowledge that you need to help your children not only get better from illnesses, but actually to thrive. So I'm very happy to be here today, and we spoke last week about boys' bits, and today is all about girls' bits. So hopefully it's helpful, and please feel free to ask questions, type it in the comment box, and we will come to it at the end of our chat.
Absolutely. So thank you, Deb. And can I get everybody who's watching at the moment live just to give me a thumbs up or a wave just to make sure that everything is working well? And remember, if you can't stay on for the whole session today, or if you know that you have other people who will really benefit from knowing this good evidence-based information, please just tag them in the comments because we'll be posting this to our pages afterwards as well, so that you can come and watch anytime. And remember, please ask questions while you're here. No guarantees we will be able to answer them. It may be a question for your doctor at that you need to go see face to face, but we'll try our best for what we can do here as well.
Yeah.
So I don't know about you, Deb, but when I brought my little newborn home, I mean, I'm a paediatric nurse. I've looked after kids for, close to 20 years, but certainly bringing home the healthy newborn was something that was a little bit different for me. And I must admit, at nappy change time, when I was presented with basically newborn, is my microphone still working? I'm getting
flashing. I can hear you perfectly. All good.
Oh, it's good. Okay. All right then. Just checking because everything's gone a bit bananas, but we will push on through. So as I was saying, when I brought my little one home, and newborn baby girl genitalia looked a lot different to what I actually thought it would. And then, of course, all of these kind of, issues cropped up along the years over the way, and being able to have the knowledge to be able to deal with that at the time and be able to talk openly about it is incredibly important. And of course, I think one of the biggest things for us was that our girls, even now, as they're older, if they do feel like that they have any issues with their genital area, they will come to us and say, my vagina is sore. My vagina is itchy. There's no shame in that. They will talk openly about it to us because they know, obviously, you talk to a safe adult about that. But I think that's a really, really important space to start, is from the beginning. Give it the right names 100%. And openly talk about it. Is nothing that should ever be hidden or shameful. So
100% agree with you. And even, my little, even my little like 3-year-old, 2-year-old.
Honestly, I think it's one of the most important.
Okay. Can you hear me, Sarah? Because I feel like there's a bit of a lag going on. Can you hear me? I can't hear you now. I know. Can everyone else hear me? Can someone just give me a thumbs up in the comments if they can hear me?
Oh, I love technology. Yeah, there we go. Deb and we are both looking at the levels now. We are both fine. We should be
great. Okay, so I was just going to say I 100% agree with you, even though, I call it girl bits, and sometimes on social media I'll call it by other names. It's often just because I don't want, the big Facebook people to think I'm talking about something inappropriate. But I 100% agree. Have the correct names. Be aware of the anatomy yourself as a parent too. and be able to use the correct terminology. You know, my little tots, even from the time, you know, they were 2 and talking, would call it their vagina, you know, and I really think that that's important. You know, it's important for you to be able to identify what problems are, as well as obviously protecting them, and not, you know, from obviously, you know, the less savory aspect of genitals. So, okay. So starting off with little babies, and, you know, as you said, Sarah, having a newborn baby as a medic or as a, you know, as a nurse, it's a little bit different. But the first thing I want to mention is that little girls' genitalia can look a little bit different, but shouldn't look too different. So by that, I mean, it's quite common for them to be a bit engorged, so a little bit swollen, and maybe a little bit bruised, especially if they've been breech babies, but, you know, just a little bit fleshier than what you would expect. But they still should have the normal anatomy. And what I am just going to mention, because I will refer to it in a little bit as we go on, is what I'll talk about as the labia majora, which is the outside of the vagina, and then the inner lips, which are the labia minora. And then, you know, there's lots of, I know, sorry, I know, I do talk with my hands.
It's good.
I know, good, exactly, right? And I'm happy to find a great diagram for you and post it on my social media. You know, you can always follow me. Oop, wrong way. There you go. If you need a little bit, but otherwise, you know, it's really quite simple to find for yourself as well. So that's the first thing to mention, is that newborn babies, it's very common for them to be a bit swollen. The next thing to mention for newborns is that it's very common for them to have a little bit of a discharge that almost looks like a mini period. By that, I mean, it's a little bit mucousy with blood in it. And that usually happens, you know, around about, you know, week 1, week 2, when they're withdrawing from the steroids, in other words, the estrogen that they've been exposed to. Sorry, not the steroids, the hormones that they've been exposed to when they've been inside your belly. And that's entirely normal, and it's nothing to worry about, and it goes away on its own. So don't get afraid if you see that. Obviously, make sure it's coming from the vagina, though, because it can be a little bit confusing. And I've spoken a lot before about poop and all those funny things that can happen. So just flag that. But if you're uncertain, just check it with your healthcare provider.
Yep.
And in terms of the newborn in the first couple of weeks, those are really the main things that I think you need to be aware of. There are more things that can happen as your child gets older. And the way that I like to look at it or describe it to parents is either there can be a problem with the appearance, or it can be symptom-based. So it could be that your child seems uncomfortable or itchy, or you could notice that there's a discharge. So I think we'll cover those three different parameters, and I think by doing that, we kind of cover a lot of stuff that you could encounter.
Yep. If I had $1 for every time I've heard, "Mom, my vagina's itchy."
Yeah.
Yep. Yep. Okay. And if you're not there yet, you will get there. If you've got girls,
yeah, it happens. It definitely happens. Or sore. I get sore with my girls.
Yeah.
So with appearance, the most common thing that would happen is something called labial adhesions. And that happens anytime from a few months old to around about 3 months old to 6 years old. Your baby is not born with this. If your baby is born with what looks like abnormal genitalia, that needs to be looked into. And that could mean something like ambiguous genitalia, which may have underlying hormone endocrine problems. So your baby is never born with labial adhesions. The reason being is that there are a few causes for it, but one of them is that it's caused by low estrogen levels. So if you remember, what I said is that when babies are in your tummy, they're actually exposed to a lot of estrogen. So they're not going to be born with a problem associated with low estrogen. The other thing that can cause labial adhesions is irritation or inflammation. And that can be from a variety of things. That can be either from a specific skin condition, such as eczema or bad nappy rashes. It could just be from chemical irritation, or it could be from trauma, either an accidental trauma or, again, just chafing. That in itself can cause quite a lot of irritation. So what exactly will that look like? If you remember, I explained the labia majora on the outside and the labia minora on the inside. It's adhesions of that labia minora.
Okay.
And you could often actually see like a thin white line or just a joining, really. And it can be of variable severity. So it can either just be a tiny little bit, or it can be quite an extensive amount. So what happens if your child has this? Well, often nothing, and it's just there and it doesn't cause any problems, and it goes away by puberty on its own. Remember, puberty, high estrogen, so that kicks in, and it resolves on its own from that. It can, however, cause a bit of irritation. It can make them itchy. It can give them a bit of a discharge. It can make them dribble urine, which isn't a problem when they're in nappies. But, if you've got a 4-year-old who's trying to toilet train and they're not able to because the urine's being trapped, behind that adhesion. So it's a physical barrier that's formed there. Mm-hmm. So if the decision is made to go ahead and try and help that break down, there are a couple of alternatives and options that you can look into. And again, this is all under the guidance of your healthcare provider. I'm merely just giving you the information so that you're aware of it, and you can have the discussion with your doctor. Yep. So one is a mechanical way, and that is, they often talk about using Vaseline or petroleum. Some people will choose to use coconut oil or something more natural. And really what that is it's just rubbing on the area that's stuck together, and with a bit of pressure, trying to break that down.
Okay.
Yeah, exactly. And I think that this is quite a tricky thing to do. To me as a mum, I would feel that would be uncomfortable for my baby, which is why it's often, I find it's often not all that successful. Then there are 2 other topical options, and one is a topical steroid, and the other is topical estrogen.
Okay.
Yeah. So estrogen has for a long time been, I guess, the more traditional treatment option. Again, estrogen breaks it down. But there are possible side effects with it. And the side effects are estrogen related. So they can get actually signs of puberty from the estrogen being absorbed into the system. And even if it improves the adhesions, they then almost get like a mini withdrawal as well after you stop it. So, I think that even though it's very safe, the estrogen cream, and I don't think it should necessarily be the first line. I think that if steroid cream hasn't worked, and that's usually betamethasone, I think that then it should be tried. It's not every child that'll have side effects, but it's just being aware that it can happen. Mm-hmm. Either the steroid cream or the estrogen cream should not be used for a prolonged period of time. Around about the 3 to 6 weeks is what I would usually suggest. Mm-hmm. And small amounts applied exactly as prescribed, only to the area, again, will minimize any possible side effects. The downside really of any topical treatment, other than, the, I guess, unusual complications related to the estrogen, is that they just don't work. And sometimes they just don't work. Yeah. And then that means that your child will need to have it, will need to have a small procedure. It's done manually under anesthetic, and it's very successful. All of these ways of managing it. So if it manages to break down with the creams, fantastic, or they have to go and have a procedure under anesthetic, you then still have to maintain it, because the low estrogen, the irritation may still be there. So yes, we have to address the irritation part. We can't address the low estrogen until puberty, of course. But we have to look at, well, what's irritating, and we'll talk about that as we go along as well, because it's kind of the general what can irritate that area. But also we have to then make sure that, you're applying a cream or Vaseline to the area every day, and as your child gets older, you can teach them how to do it. And it's just to keep that area from becoming, again, irritated, and when something gets irritated, it gets friable, and that's when it can then adhere together. So that's how the cream stops it from doing that. So I think that's explained that quite well then, Sarah.
No, absolutely. And I think especially that, we can't just fix the problem. You've got to go to the cause as well. So what's the cause? And I think certainly that's something that
But I know that I get a lot of parents who are concerned about the estrogen cream. So again, I do just want to say that, in my opinion, it shouldn't be a first line, but it is definitely an option, and not many children will have side effects if it's used correctly. And those that do have side effects, by the way, they do go away. I should have mentioned that. They're not long lasting. So as soon as the estrogen is removed, then those effects slowly go away.
Yep.
Okay.
Excellent. We're going to talk about, so just so you know what else we're going to talk about today, we're going to talk about discharge, because that's something that, that often you're curious as to when and why that will happen. We're also going to talk about sore vaginas and itchy vaginas, because that's something that you can guarantee that your toddler will end up saying to you at some stage. And also we'll just talk briefly about what is Deb's gold standard for cleaning your baby's vagina? Because, that's certainly something that, often you can question whether or not that perhaps what you're doing might actually be irritating their vagina as well. So shall we go on with discharge, Deb?
Sorry. Yeah, I spent quite a bit of time on that, but I think it's an important one, and I know it causes a lot of parental anxiety. Okay, so itching. There are a couple of causes for itching. Yep. The most common that I would see has to be around mild irritation or something called vulvovaginitis. It's very, very common. It's, other than itching, it can be a bit uncomfortable. Your child can also complain of pain when they're urinating. So that's called dysuria, and it looks red. Yeah. What's that from? It's often from being in swimmers for too long. It's summer there in Australia now, so that's a common complaint. Or wearing underwear that's nylon, bubble bath, not cleaning properly or often enough, and using other creams that may be irritating, not wiping properly when they go to the toilet. So really, it's just a localized inflammation secondary to some form of localized irritation. The treatment for it is removing all those irritants, being very aware of hygiene, teaching your child. I mean, it's really hard. And I know my girls come home with this quite often, especially when they're at school. They don't wipe, from front to back, throw it away. They kind of do something random down there that I don't really want to know about. But, it really is taking them step by step, exactly what they need to do when they're in the bathroom, and washing their hands afterwards as well.
And I think that's really important. I think sometimes that we just might think that they are going to automatically know that you have to wipe from front to back, and that we presume that all adult women know that as well, but they don't. So that's really, really important that, that we do teach our girls to wipe front to back.
Yeah. And it's hard also for little kids because their arms are little, so they can't actually wipe in the same mechanism. So really it's taken from the front, and then my daughter knows, she goes as far as she can and drops it in the toilet, so I think that's, you just got to work around it and work through that. But definitely no bubble bath is another big one. Straight out the swimmers when they're wet as soon as you can, and cotton underwear.
Yep, absolutely. So I can remember seeing one of my children like this, over, arms under. They're like, trying to get that front to back. And you know what? Let them do it. As long as they're trying, I think it's probably okay.
So what else am I going to say? So, I mean, they can also have a mild discharge from that with the itching. With the vulvovaginitis. The other thing with itching is that it can be from worms, pinworms. We spoke about this before, Sarah, and for those of you who missed it, we did a great Facebook Live all about parasites and worms. So please go find that, or maybe we can link to it in the comments as well to make it easier.
of our pages. So all you need to do, go to the video section and you will find it there. So worms and parasites.
As well. And don't forget it, because it's definitely possible. The worms wriggle up into the vagina. I know it's disgusting. Okay, so I guess those would be my major things with itching. Moving on next to discharge, I've already mentioned the newborn with that little bit of what looks, that little bit of blood that they get, that bit of spotting. The next cause of discharge is going to be your infections. As I've already mentioned, your vulvovaginitis. Children can also get something called a vaginitis, which is very unusual. But what they can do is actually put little foreign bodies in there. It's very common. It's normal behavior. It doesn't mean that they've been, sexually assaulted. It really is just part of exploring their body. They stick things up their nose. It's a hole. They'll stick things up in their vagina too. It's as simple as that. Yeah. The clue to that usually is that it is very, very smelly. So I'll just back up a little bit and say a little bit of discharge that's clear, maybe a little bit white, that doesn't smell, is normal. Because vaginas are moist places. Normally, it's healthy. It's a healthy vagina. So it is very, very normal to have that with young children. But it's when it becomes an abnormal color, so a yellow, a green, blood-stained, again, that makes me think of a foreign body, or very smelly, that we then have to look further. And I'm sure that you've seen foreign bodies, Sarah, having worked many years in the emergency department, because I know that I have.
Yes, I have seen sorts of different things, from bits of toys to even, interestingly enough, a lot of what I've seen when it comes to little girls putting foreign bodies in their vaginas is stuff that's been accessible at bath time. So, for example, I had one little girl who actually took a tap apart and put some of the parts of the tap into her vagina and also her nose. So she was, as I said, it is literally just finding a hole to put something in. Yeah. It's not anything else with little kids. It just is, and it's okay. It's not okay because they have to, obviously have to have it fixed, but it's okay to explore their bodies. We can never, ever, ever shame them for that.
100%, yeah. And I think that's kind of wrapping it up. In terms of cleaning, and we've touched a little bit on children who are toilet trained. When it comes to nappy time, again, it's the front to back, and I really think that's my main message. As you know, I'm very pro natural products. I don't like anything that's fragranced or with lots of chemicals, and I often find that that's quite irritating, because young children, prepubertal children, have their skin and their vagina is actually much more sensitive, because it hasn't had the effects yet of hormones, which makes it less sensitive. So it's much more vulnerable to all those chemicals. And so, find your products that don't contain any of the nasties, or use your own, use tissues, cotton wool with water, depending on what you want to use, but it really is the wipe down. If they've made, clean, making sure you clean as best you can, behind the labia majora, especially if they've made a poo, because bits of poo can track inside there, and that can definitely cause either a urinary tract infection or localized irritation and a vulvovaginitis and nappy rash. That's another big thing that we haven't touched on today, but I guess we can talk about that separately on a different day. But I think, that to me is the message. I'm a fan of barrier creams. I do not like, the cornstarch talcum powder world. It's just not what I prefer. I have my personal preferences for barrier creams. They're all zinc based, because that's what you really want. You just want something that's going to seal the skin off. As an aside, try to choose products for young babies that don't have food stuffs in them. And by that, I mean the almond oils, the coconut oils, because there has been a link to, increased risk of food allergies if you're placing it on broken skin. So I'm talking about child with a bad nappy rash. Those would really be my tips. And changing diapers as frequently as you can, choosing one of the least chemicals if your child is getting, irritated skin can also help.
Yep, absolutely. And I think that's an important thing. I mean, when my girls were little, I would just buy a stack of those really thin face washes and would simply wet them in water and use that to clean them, because both of my girls have got quite sensitive skin, and that was what worked for us. So it's about figuring out what works for you, and I think that's an important thing. And also, and it's important to make sure that if your partner or whoever else is looking after your baby, that you're all on the same page about how to do this as well. Don't presume that your partner or grandma or whoever is looking after them knows how to do this as well. So, sometimes it can be a bit tricky. The reason I say this is because I had somebody who went to go and look after my baby who hadn't really been around little babies for a very, very long time and was too nervous to go in there and actually clean them well after a poo with their nappy. And so being able to reassure them, go, actually, we really need to do this. So make sure that everybody's on the same page as well. So that's an important thing. So do we have any questions at all? Please type them in the comments below right now before we finish up. And the good news is that Deb and I will be continuing to broadcast to you at 12 p.m. every Wednesday for the next series, which we will be letting you know about really, really soon. So make sure that you subscribe to the Baby to Toddler Show, Dr. Deb Levy and CPR Kids, so you don't miss out on all of these really informative Facebook Lives that we will doing. And remember, we want to do what you want to know about as well. Type in the comments below what you'd like to know about when it comes to pediatric health, so the health of your little ones, because that's what we're here for. We're here to answer your questions and be a resource for you. So please type them in the comments below and we'll be able to bring you a Facebook Live on that. So, Deb, it doesn't look like we have any questions today. So that's good.
Hopefully I answered them all already.
Already, that's exactly right. That is what we will tell ourselves. Either that, or perhaps, maybe we did. Maybe we did answer everything. So as a recap, remember, if you are concerned, please go and see your doctor or your maternal and child health nurse. If you are worried in any way, please make sure you do that. Don't just hang on to it. Go and see someone. There's no silly questions. Okay? So thank you so much for joining me today, Deb.
Thank you. Thanks, Sarah, and thanks for everyone for listening.
Okay.
See you soon. Bye.